Let me welcome all the speakers of the day. So, it's very interesting. We have always had this, view, at least the physicians and the healthcare providers, we've had this view that technology providers, we've always treated them as vendors. But now it's very, very clear that the relationship has to change. We can no longer be a client and a vendor relationship. We have to work as partners. And in this partnership mode, we can look at very successful rollouts. So I'm going to call Mr. Ian Hogan. So a brief introduction. Mr. Ian is the Chief Information Officer of Northern Care Alliance NHS Foundation Trust. And he has studied digital leadership from the Imperial College, and he's been in the space of digital health for nearly 2 decades. Welcome, Mr. Ian. We'd love to hear from you and your NHS experience.
Thank you. And thanks for the opportunity to be able to speak and engage with everybody on the session. There's a couple of things that I'd like to really share, and I suppose it's some insight into successful rollouts of technology and certainly where we've been able to enable that and how we've supported that across the organisations that I've worked in within the NHS and where we are now. So I work in the Northern Care Alliance NHS Foundation Trust. We're one of the largest hospitals in England. We have over 24,000 staff, 15,000 end user devices. We care for a population of approximately 1 million people within the Greater Manchester region of England, which is in the northwest of the country, and we provide a range of services across hospital, community, and also aspects of adult social care. And as a really large organisation, we have a number of challenges that we generally come across in relation to our technology rollouts. And I think if you haven't already been involved in one, you'll certainly have heard of one in relation to where there's been an unsuccessful rollout. National figures state 30% of technology programs fail. As I say, we've probably all been involved or aware of one. I was involved in one in the UK, which was the National Programme for IT, which was looking at deploying a standardised single EMR across a number of regions within the country. We were split into 5 regions to be able to deliver, and we didn't really achieve or succeed in a lot of what we tried to do. And I think one of the things that really sort of drove out of that and the learnings, and something that we've looked at over a number of years subsequently, the successful deployment, it falls into 3 categories. It falls into the why, the what, and the how. And I think there's an equal measure of importance associated to all. The why is probably the single most imperative piece, because not only from a digital team deploying technology, but also in relation to a clinical workforce, and maybe more importantly, a vendor provision perspective, to ensure we know why we're doing and why we're looking at deploying what we need to. We've seen a real mindset change, certainly within my organisation, and a lot of the drive that we've had historically has been around efficiencies and effectiveness of care. And I think we've missed, certainly in the engagement piece and understanding why we're doing things, the patient safety element. And the support to clinicians to ensure that whilst we deliver safe and effective care, ultimately we really deliver safe care, because that's something that, as a patient comes into and under our responsibility, the very trusting in relation to what it is that we need to do, to understanding the problem, understanding the issue, understanding the initiative in relation to if you like, that problem statement or that question that we want to answer is vital. And I think it's vital in relation to the vendor relationship as well. In the UK, we have a tendency to favour large American monolithic EMR systems. As a result, we tend to be a very small percentage of revenue into them organisations. So trying to get things changed, adapted, improved, or even added to can become difficult at times. And I think there's an element in that why, in that first stage of engagement and understanding requirements to really be able to build on and understand the relationship and how that will work within the vendor market. There's nothing worse than having gone through a deployment cycle, then as part of a, if you like, an additional optimization piece, finding out some additional functionality that will really benefit and support what the services that we provide, to find out that actually the influence on the vendor for them to actually deliver that is minimal, or has a real length of time associated to it. So understanding that's really important, and that sort of flows into the what. So understanding the requirements is the first stage, and then we'll look, so what are we going to do about it? What are we going to deploy? How are we going to address it? How are we going to respond? And this is where there's a real imperative in engaging across that clinical workforce. And one of the drives that we've got in my organisation at the moment is around user-centred design, and ensuring that we take our clinical colleagues, our administrative colleagues, and also, importantly, where possible, our patients on that journey with us. One of the things that we're seeing, and a real big push that we've got within the UK at the moment, is around patient access to records. So while we've got really rich primary care records and there's a level of accessibility into them, we're at a really varying stage of digital maturity across the hospital sector, and also the technology that enables us to do that. In a couple of the previous sessions, there's been some really good comments in relation to, you know, one size doesn't fit all, around standardization, around integration, but also the opportunity in relation to an agile approach. And again, and it comes down to that understanding the why and understanding the what. Because if you're building something around patient need and patient accessibility, then your monolithic EMR probably isn't the way to start. Your device that you're going to access, the availability and the accessibility, and the agile requirements of the workforce are probably one of the key areas, and also where you're going to treat patients, where you're going to see them, and what interaction you want. There was a mention earlier around remote monitoring and nurses who come in to start the shift and go around and take all obs of patients under their care at that moment in time. And once they've finished, they've got to start it all again. Well, there's an element of embracing technology and being able to support that. But again, it's why you're doing it. What are you going to do in relation to how you're going to record it and how you're going to service it? And then there's the how bit. And the how bit is I suppose, the meat and bones of rollout, of delivery. So it's whether or not it's an agile approach, whether it's a waterfall approach in relation to delivery. I think one of the important things is to gauge the requirement based on the technology that's being deployed and the environment that's being deployed into, and being able to engage and take with you on that journey your clinical staff, your administrative staff is really important, and ensuring that there's that buy-in to be able to understand what's happening, and to a lesser extent accept it, but also to take ownership. So from my personal experience across a number of organisations where we've generally either failed or not succeeded as we'd have liked to, generally falls into that transfer into operational ownership, and the ability and the understanding of the, if you like, the recipient workforce or clinical areas of what it is that we're trying to do. I mentioned the National Programme for IT earlier, and that very much was a digitally driven deployment across organisations, and certainly what we've done in my organisation is shy away from that. The only technological rollouts and programs that we own and accept, if you like, that lead play in from a digital perspective is around our core infrastructure. Anything that has that clinician, patient, partner engagements as we broaden out across the voluntary sector and other areas across the UK. We have to make sure that digital is seen as the enabler, and we are providing a solution to a problem or an answer to a question that has been posed to us either from a patient perspective or from a care perspective. So the how bit really has shifted from an emphasis point of view around, we've got a digital solution and this is how we're going to do something, as opposed to, we understand what your need and your requirement is, and build that relationship of how we actually are able to do that, and really drive that forward, ensuring that there's the right, and then relationships really help in relation to, from a clinical governance perspective, and I suppose that ensuring that we've got that clinical safety associated with everything that we do. My organisation at the moment are extending the deployment of an EPR across 4 hospital sites that we've recently taken responsibility for. One of the issues we've got is around clinical decision making and clinical policies and processes, and the approval. So we've got 600 clinical processes across a myriad of specialties, and they've been allowed to grow the way they have because of the insular view in relation to each of the hospital environments. So in bringing them all together, one of the things that we've got to drive is around how we ensure that clinical governance and the clinical safety in relation to the policy and the processes, and that we avoid the political bun fight in relation to, well, my policy is better than your policy, which is better than their policy. My clinical practice is better than your clinical practice. So ensuring that we've got everybody on the journey, we've got that engagement, because that will then enforce and show and give us that pathway in relation to how then the technology supports. Because if we try and adopt all 3 and support all 3 from rolling out that technology, we're doomed to failure, and we don't want to be one of them in that statistical group which really drives that forward. So there's an element in relation to the engagement, the communication, the involvement, and I suppose that includes the assignment of roles from the clinicians. We have an approach where our expectation is that the senior responsible owner of any of our deployments within a clinical environment is owned by a lead clinician, not necessarily within a specific specialty area, but somebody who's got that understanding in relation to what we're trying to do from a digital perspective. And we've got a chief clinical information officer who's fantastic, and we've got a number of deputy chief clinical information officers as well, which really help and support how we can drive and how we get that engagement across our clinical colleagues to ensure that we don't fall into that piece The last sort of couple of points I think I'd like to finish on is just around that there's an element of certainly from a technical perspective of being quite poor at times in relation to documenting process and real drive. I think there's a real importance of making sure that the key areas are really documented and we've got that robust process in place that'll support a further review in relation to how we communicate, not just to within the areas but also across the whole organisation. Having that board level and executive buy-in is really important. If we don't document, if we don't communicate well, if we don't understand the why, the what and the how, then we're really putting ourselves in a position where we may well lose some of the interest and some of the drive that the hospital board can actually give us and drive from that perspective. And then I suppose one of the final things is around reviewing and adjustment, about continually looking at how and what we're doing. I suppose it's what and how we are doing it. Have that constant review point, and if we see something that's not sort of fulfilling or delivering the ambition of the program, we'll adjust it. Have the confidence to be able to challenge. Have the confidence to be able to say, actually, we need to pause because we need to review and we need to adjust because we are going off track, and we're able to sort of to bring that back in. So to sort of bring it back to the beginning, it's about why, it's about what, and it's about how. And if you understand and you can influence on the three of them, then you're more likely to be able to succeed. Hopefully that's been insightful and has given some room for thought, and again just like to thank you for the ability to participate in a really exciting agenda.
Thank you so much, Ian, for bringing out so eloquently the need for, you know, a sense of ownership in every participant and every stakeholder that there is. And also the agility to continuously evolve the technical system so that it can meet our needs, because we are continuously growing. Thank you very much. And just to conclude the session for the day, I think it's, you know, starting from where Dr. Devi Shetty had very clearly told us as to what is expected of technology, and that is delivery of safe patient care. And that is what, in a rollout, what is that we expect that we have to do. So Mr. Subramaniam very eloquently told us how they have, tried to resolve the question of access and quality healthcare, and also capacity building to match the requirements at the rural space, and then to connect the rural urban so beautifully so that the ecosystem is developed very well. And then for this ecosystem to develop well, what Mr. Ian said is so logical, is that we have to have a collaborative ownership, stakeholder ownership mindset, and an agility built in not only to the technology, but also the way the healthcare providers look at how we provide healthcare. And Dr. Harsh Mahajan has told us what the journey ahead is going to look like. We haven't even seen the tip of the iceberg. And if digital technology and evolution is, whatever we are seeing right now, the way it is rolling out, it's exciting times for the healthcare providers, because we can expect to roll out healthcare and to provide healthcare in a billion ways better than what we are doing today. And the beneficiaries at the end of the day, it is the patient and the entire health ecosystem and the provider fraternity really taking the lead. And I hope that we are able to take the lead in this journey and be a partner with the technology providers, because we are now the technology providers are part of the provider team and we are on the same side. So thank you very much to all the speakers.